Okay, hi, another video doing of a Zimmer implant system placement. Real big fan of Zimmer, and I'll go through the video on why I like it so much. Thanks for watching. Okay, so it looks like it's a number, I believe 29, premolar area, lower jaw. Yeah, actually that's a Zimmer implant behind it, that side as well. I placed that maybe a couple years ago. And on the x-ray, yeah, it looks still great. Still, obviously, of course, screw retained as usual on the back one. So I'll be basically doing a similar type of implant case just right here. So yeah, that's the pilot drill with Zimmer. It's really nice. It's very good quality drill material. Yeah, very nice drill. Zimmer's metal, all their stuff, top of the line. Yeah, so here we go. Just when it's in a situation like this, it's really easy to figure out placement. Yeah, maybe I could have done a more less invasive flap just to protect the implant behind it. But yeah, so here you're just trying to work out angulation. I think I'm running at 1500 RPM, I guess. I always usually like to run at least 1500 for the lower jaw because the bone's quite dense. And here, yeah, you can see the hole right there. And I always check the occlusion, make sure that the implant's going to be angled right toward the opposing tooth cusp. Because, yeah, you always want occlusion done right. Bad occlusion, cervical bone loss always happens. So yeah, now the bone is actually a little bit resorbed on the buccal side. It's kind of sloped like a hill. So here we go, next set of drill. And I'm trying to get it to depth with this drill. Yeah, the case he had, you know, not ideal, but pretty good bone. He had a good amount of depth to the bone, which is great. Just going through this drill set. So you're basically with implant surgery, you're just enlarging the surgical site slowly, drill bit by drill bit. So here's a parallel or pin, and that's just your guide pin. And this is where you want to test where exactly is the opposing tooth biting down. So your implant crown is going to come out in that angle. So at this point, yeah, you get down right where it needs to go, the opposing cusp. So then, really, at this point, it's just enlarging the bone site. You can make slight adjustments to the angle as you enlarge the site, but most of your depth drilling should be done in the early stages of the surgery, not towards the latter. You want it, the depth should be cut with the smaller drills, and then the angulation can be adjusted with the bigger drills. So that's kind of my whole rule, the way I do it. Yeah, to depth right away. The bigger drills are pretty much just to angle the final implant where you want it. So yeah, so this majority of this video is just me going through the drill sequence. It's pretty boring, straightforward. This video is a little bit longer, but I wanted to kind of make a video showing from beginning to end. There's a sound in the background. Someone's doing gardening or something. It's crazy annoying. Yeah. So, there we go. Shut the door. Very boring video. Zimmer implant. Why I like it is the cervical area of the Zimmer implant, for some reason, it's all optimized to reduce bone loss in the cervical area. Just the way they designed the implant, just to the platform itself, really is all points to decreasing bone loss. They really, I think they are the best in terms of bone and everything. I mean, there's a reason why it's an orthopedic company. Comparison to Hyosin and Nobel, listen, like all these implant systems, I'm sure they're great, they all work, you know. You're just coming down to little minute details. So there it is, there's the Zimmer implant. Not really aggressive thread pattern actually. But if you look at that cervical area, you see how it kind of micro threads towards the top, the cervical area. So you have like bigger threads in the bottom, and then it micro threads toward the top. You know, that's really a good design, really well done. I think it differs from hyoscine, where you don't get that level of micro threading toward the cervical area. And that micro threading, I think, provides more integration, more connection with the bone, so that it can withstand cervical occlusal forces and less bone loss. In this guy's case, you'll actually see on his opposing jaw, I did a hyoscine implant, and there's a tremendous amount of heavy occlusion, which led to a lot of cervical bone loss. So, yeah. Yeah, so the implant's in. We're just checking the bite again, making sure is it going to occlude right. I mean, there's not much you can do at this point. Well, you can if you want to take it out and re-angle the drill and get a better angle if you wanted to. I do that all the time. So my advice to guys is if it's not angled the way you want it, really don't be afraid to just take out the implant and re-angle it and put it back in. Yeah, if you don't do it, you're going to pay for it later when it comes to making the implant crown. So implant, even with the implant in, it's not the end of the situation. If you don't like the angle, always do implant with the final product in mind. It's not just putting the implant in. And that's kind of my thing where I don't like the oral surgeon or perio doing the implant surgery and the doctor just restoring. To me, that's just really not an efficient way to be doing implant dentistry. One person does everything from beginning to end, from the surgery to the restoration. One person needs to take ownership over the case and warranty the case and everything from beginning to end. That's the way, to me, that's how implant dentistry is done. Okay, so almost over. The rest of the thing is just suture. Then it's just suturing, and then we're going to finish up the case here. So in about 2 to 3 months, we'll be ready to take an impression and do the crown. Yeah. So this is a very typical routine implant case for me. This is kind of my bread and butter go-to procedure in my practice. I don't do much of anything else. I don't do much fillings. I actually don't really like doing fillings. They're fun and all, but they're really annoying. Yeah, just do a lot of implants. I guess that's where my dental career is kind of headed. It's fine, because it incorporates all the dentistry, from surgery to pros. So yeah, we're just finishing up this here. Well, the rest of the video is just me. Snip, snip, suture, and that's about it. Alright guys, so thank you for watching this video. Have a nice day.